Hello, I'm Dr. Craig Stern of Pharma Pharmaceutical Consultants. Over the past, we've talked a lot about brands and generics and definitions and things like that. And in the last series, I talked about certain contract elements that I thought needed to be increased some so that people paid it some more attention to it, even though they were in the master contract. I want to go back to something because I've been asked some questions about it. I want to make sure that we try and further clarify, and further clarification, frankly, is not bad in this regard. And just in full disclosure, I do spend a significant amount of time looking at definitions and things. I was originally a physicist, and so when you deal with formulas, when you deal with any kind of estimates, you want to know exactly what your definitions are, what the limitations are, things like that. I want to go back here for a moment to brands and generics and definitions, but really from a contract standpoint. And in this regard, I've talked about definitions, and you have to have definitions for brands and generics. There are FDA definitions for brands and generics. But why the emphasis? Why the worry? Why the problem? If you take a look at how claim administration is done, and we have several reference databases, national reference databases, like First Data Bank, used to be known as Blue Book, and Medispan and Red Book, used to be known as Red Book, then effectively we have references for how these are to be done. And they have a group of different parameters to decide whether something is brand or generic. It's not just one. So there is a certain amount of discretion. And if someone is looking at this and says, well, you know, it's really clear what brand and generic is, as a pharmacist, I think that it's pretty clear what brand and generic is. But when you look at the coding of brand and generic, it's not that clear. And most importantly, when you look at the national databases and how they do it, it's not entirely clear the way they do it. Some may identify, well, we use one or two parameters in order to define brand or generic, and that's enough. And the reality of it is depending on who looks at it and what parameters they use, you can come up with a different definition. Now, why does it matter? When you're dealing with the contract, clearly you want it clearly defined in a contract as to what parameters and how things are going to be defined as brand and generic. And why so? Because in your benefit, you have expectations that there are going to be certain drugs that are brand, certain that are generic. Individuals are going to pay certain co-pays based on brand or generic. In the case of Medicare Part D, individuals will be paying more or less towards their true out-of-pocket maximum, whether it's brand or generic. It's not trivial. Brands cost over $100 every 30-day retail prescription. Generics cost about $20. So when you look at it, you could get 5 generic prescriptions approximately for one brand. Well, when you use these kind of guesstimates and estimates that I'm talking about, it really does matter what parameters are being used and how they're defining these things, how they're defining an over-the-counter product. Is it a brand or is it generic? How they're dealing with private label, that you can walk into a retail pharmacy or retail store and buy it as their particular private label brand or generic, and how is that going to be identified, paid, based on whether it was brand or generic, and how much the individual or the patient is going to pay as well. So we're talking about something that does have a significant basis in it. I stress it, and I've been asked questions about this. I stress it because what would seem to be relatively simple, direct, and easy is in fact not that easy when you're adjudicating a claim or when you're dealing with business logic. It has to be defined up front and certainly ensured that whatever your benefit is, whatever definitions you've got and however you want to do it, that whatever's being done in the business logic is consistent with what your definitions are. If you don't do that, then there's always going to be surprises downstream as to what you've paid, your reporting, etc., how it's done. And frankly, when people report, it isn't quite clear what was included under brand, what was included under generic. If it was coded as generic but paid as brand, why did that happen? There's a whole plethora of questions that come up, but you can't ask those questions if you don't know the basics. I strongly suggest to you that you pay attention to that and include that in your overall thinking. I wish you well, and thanks so much for spending time with me today.